Good morning, everyone. Thank you so much for joining us. Welcome to our Clean Air webinar series. These webinars are developed in collaboration between the Alberta Capital Airshed and West Central Airshed Society. My name is Selena Fairbank, and I will be your host this morning. I am the Engagement Coordinator for ACA. Today's webinar is titled Air Quality and Aging, Supporting Seniors in a Changing Climate. Today, we will hear from 3 expert speakers on the health impacts of climate change for vulnerable populations like the elderly. Our speakers will delve into the intersection of air quality, aging, and community support. Our topics today include the impacts of air pollution on brain health, particularly for seniors with dementia, and how poor air quality events can exacerbate health risks. Participants will learn strategies for engaging with vulnerable demographics and protecting older adults during poor air quality events. Additionally, today's session will highlight collaborative work with airsheds and discuss the challenges and considerations of working with seniors during emergencies. I'm happy to welcome our 3 knowledgeable guest speakers who are here to share their research and experiences with us. We have Dr. Ryan Allen, professor in the Faculty of Health Sciences at Fraser University. We have Dr. Shelby Yamamoto, Associate Professor of Environmental Epidemiology at the University of Buffalo, and Kristen Chambers, Chief Administrative Officer for the Evergreens Foundation. Before we get into our presentations, I do want to provide some information about Alberta Capital Airshed and West Central Airshed Society. Both airsheds are not-for-profit, multi-stakeholder organizations responsible for air quality monitoring in our regions. The air quality data collected at our continuous monitoring stations is reported to the public and used to calculate the Local Air Quality Health Index, or AQHI. We also operate a large network of microsensors that measure fine particulate matter. We provide outreach and educational initiatives like this webinar series to increase air quality awareness and address local issues. ACA and WCAS are 2 of 10 airsheds operating in Alberta, and over 88% of Alberta's population resides within an airshed. If you would like to learn more about airsheds, you can visit our websites at www.capitalairshed.ca or WCAS.ca. I'd like to acknowledge that Alberta Capital Airshed is located on Treaty 6 territory, and West Central Airshed Society is on Treaty 6 and 8 territories, the traditional and ancestral territory of many First Nations, including the Cree, Dene, Blackfoot, Saulteaux, and Nakota Sioux. We acknowledge that this territory is home to the Métis Nation of Alberta. We acknowledge our part in treaty by being thoughtful about the air we breathe and how we can work to ensure it is healthy and life-giving for our Earth, the current generation, and for many generations to come. I invite you to take a moment to consider the land and air from which you join us today. A little bit of housekeeping on how today's webinar will work. It will last for approximately 60 minutes. Each panelist will do a short presentation, and then we will open the floor to your questions. You can register your question using the Q&A box. There's also the chat box available, and comments are welcome in this area. This is for sharing any additional information you think others on the call might be interested learning about, something from your organization, a news article, etc. We won't be getting to comments box for Q&A, but please feel free to use this tool to enhance the experience. The webinar is being recorded, and the recording link will be distributed via email to all those who registered within the coming days and available from our website. Please feel free to share the recording link with anyone who may be interested. With that, on to our first presentation. Dr. Ryan Allen is a professor in the Faculty of Health Sciences at Fraser University. His research bridges exposure assessment and epidemiology to evaluate the health impacts of air pollution exposure. He has led several studies on the potential health benefits of using portable air cleaners to reduce exposure, and today he will be talking about the relationship between air quality exposures and brain health. Welcome, Ryan.
Okay, thank you for the introduction and for the invitation to participate. So what I really want to do is just kind of give a primer on air pollution, wildfire smoke, and brain health. And the first kind of introductory comments I make will be about kind of air pollution in general, and then I'll finish by focusing more specifically on wildfire smoke. So, as most of you probably know, air pollution is a mixture of a bunch of different pollutants, particles, and gases. But the single pollutant that probably best characterizes the health risk from the air pollution mixture is fine particulate matter, or PM 2.5. So these are very small particles. That can penetrate deep into the airway and cause lots of health problems. And there's, as you probably know, really very compelling evidence that air pollution has major effects on the health of populations. So globally, it's estimated something like 8 million deaths per year are attributable to air pollution. That's roughly one out of every 8 deaths in the world. And air pollution is among the leading contributors both to death and also to disease burden. That is kind of the combined measure of death and living with an illness or a disability. And importantly, we see effects from air pollution even at relatively low concentrations. So there doesn't seem to be any kind of threshold or any safe exposure level. And that's important in a place like Canada, where we have, at least in the absence of wildfires, we have relatively good air quality. But even at those relatively low concentrations, Health Canada estimates something like 15,000 premature deaths every year from air pollution in Canada. And those large effects are the result of air pollution increasing the risk of a number of health conditions. And so this figure shows in red health conditions where air pollution has been kind of definitively linked. That is, there's sufficient evidence to indicate kind of a cause and effect relationship. But there are other effects here listed in blue where there is maybe slightly less evidence, or maybe the research is still emerging, but where there's at least kind of a suggestive association with health effects. And a number of these, of course, would affect seniors, but one that is, I think, particularly important to think about is cognitive decline in adulthood. Um, and this has been a growing, a very active area of research over the last number of years. Now, quite a substantial body of evidence linking air pollution with dementia. Many of the studies published just within the last few years. The strongest evidence is for PM 2.5, although other pollutants have been linked as well. And based on what we know about kind of the biology of how air pollution affects the body, this is entirely plausible. But what's important about the kind of emerging evidence in this area is that the message is now being taken up by a broader community. So as an example of that, the Lancet Medical Journal a number of years ago convened kind of an ongoing commission on dementia that was tasked with periodically reviewing the evidence and making recommendations for prevention and interventions and care. And just in their last couple of reports, they've begun to recognize and highlight air pollution as an important risk factor for dementia, and have recommended reductions in air pollution as an important strategy for reducing dementia risk. So again, that's really significant because it's not just kind of, air pollution nerds like me beating this drum, but this message is now being taken up by a broader community of medical professionals, healthcare professionals, public health professionals, and so on. So while all of that is happening, while there's this kind of emerging link between air pollution and dementia and other forms of brain health, we of course have wildfire smoke kind of changing the air pollution picture. So as you probably know, we've had really good success in North America and other high-income regions of the world at improving air quality. This figure shows kind of long-term average PM 2.5 concentrations across North America. And over the roughly 35-year period depicted in this figure, PM 2.5 levels were basically cut in half because of legislation and technology improvements and other changes. But of course, wildfire smoke is kind of changing that story. This figure shows trends in PM 2.5 kind of pre-2016 versus post-2016. And you can see that these graphs look sort of like hockey sticks, with the steepest post-2016 increases occurring in Western US states where forest fires are most common. And of course, places like Alberta and BC would follow a similar pattern. And what this analysis found is that the deterioration in air quality since 2016 had eroded anywhere between 25 and 15% of the progress that we had achieved in the several decades prior to 2016. So wildfires are kind of undoing progress in air quality that took us several decades to achieve. And that is important for public health in places affected by wildfires, including Western Canada, of course. Wildfires are pretty strongly linked with respiratory and cardiovascular health, and like sort of the general air pollution mixture that I referred to earlier, wildfire smoke is also increasingly being linked with brain health. Many of the studies have focused on kind of short-term or acute exposure. This is one example. This was a study in the US that looked at the effects of PM 2.5 and wildfire smoke on attention. So they obtained scores from an online attention-oriented game that users play. In the game, your score depends kind of on your ability to pay attention to details. And they found that within hours to days of wildfire smoke, scores on this attention game had deteriorated, suggesting a reduction in attention. But the very nature of wildfire smoke is changing, and it's changing the way that I think, have to think about the health implications of wildfire smoke. So last year, a colleague of mine and I published this article in The Conversation where we commented that historically wildfire smoke had been thought of as sort of a sporadic, short-term, transient event. But really, given that wildfires are becoming more common, they're lasting longer, they're more intense, we need to shift our thinking to start thinking about the kind of chronic exposure to wildfire smoke and the long-term implications of that. And of course, we're not the only ones. There's nothing particularly novel about that idea. We're not the only ones thinking along those lines. A number of researchers are now starting to investigate, or have been investigating, wildfire smoke as sort of a chronic exposure and its associations with more chronic diseases. So I'll just finish by giving a couple of examples of those. This was a study in the US that looked at links between, or associations between, PM 2.5 and dementia. And they looked at PM 2.5 overall, but then they also looked at PM 2.5 from 9 different sources. And they found that the most consistent, most robust links that they saw with dementia were for fine part PM or PM 2.5 from agriculture and wildfires, suggesting that of all the PM sources, those sources might be particularly important when it comes to dementia risk. And then just a few months ago, there was a similar study published, and this was, you may have seen this in the CBC or other Canadian news outlets that reported on this study. In this analysis, they looked at kind of wildfire smoke PM 2.5 and then non-wildfire PM 2.5, or in other words, kind of wildfire smoke and everything else. And again, similar to the previous analysis, they found stronger associations between wildfire PM 2.5 and subsequent dementia, and argued that in addition to kind of improving air quality overall, we may need to specifically reduce wildfire PM 2.5 exposure in order to reduce dementia risk. So just to summarize then, there's really a very well-established body of evidence demonstrating that air pollution has an enormous impact on mortality and the burden of disease. And this is true even in relatively kind of unpolluted settings. We've had great success at improving air quality in North America, but a lot of that success is now being eroded pretty quickly by smoke from wildfires. And there's now considerable evidence that air pollution affects brain health and increases the risk of dementia. And importantly, there's emerging evidence that wildfire smoke may play a particularly important role of that. And of course, this is something that we'll need to keep in mind, given that we have an aging population, a population where dementia prevalence is increasing and where wildfire smoke is becoming more endemic. So thank you for your attention, and I look forward to the discussion.
Thank you so much for that, Ryan. As many of us have aging family, I think this information is really important to keep in mind. Not only that, but we're also aging, so it can affect our own health long-term too. Before we turn to our next presenter, I do want to mention that if you're enjoying this webinar, or you know someone else who would like to engage in the work our airsheds are up to, there's a couple of great ways you can stay informed. You can sign up for our monthly newsletters on our websites, which are in the chat, linked for you, or you can follow us on our social media. You can find the links to our social pages at the bottom of our websites as well. You can also view past recordings in our Clean Air webinar series under the Education and Outreach tab on our websites. We have some great resources there for everyone as well. With that, let's turn to our next presenter, Dr. Shelby Yamamoto. Dr. Yamamoto is an associate professor of environmental epidemiology at the University of Buffalo, New York, and head of the Climate, Health, and Environment Epidemiology Research, or CHEER, lab at the University of Alberta, which focuses on climate change, air pollution, and health. In particular, her work involves investigating air pollution and climate change exposures, developing and exploring ways to capture climate change and air pollution experiences related to vulnerability, assessing mitigation and adaptive capacity, and promoting community resilience. Welcome, Shelby.
Thank you very much. So my name is Shelby Yamamoto, as Lena said. So I used to be at the University of Alberta, and I have just recently switched to the University of Buffalo in New York. So the land acknowledgement that I want to give today is based here. So since I'm at the University of Buffalo, it operates on the territory of the Seneca Nation, a member of the Haudenosaunee Six Nations Confederacy. So this territory is covered by the Dish with One Spoon Treaty of Peace and Friendship, a pledge to peaceably share and care for the resources around the Great Lakes. It is also covered by the 1794 Treaty of Canandaigua between the United States government and the Six Nations Confederacy, which further affirmed Haudenosaunee land rights and sovereignty in the state of New York. Today, this region is still home to the Haudenosaunee people, and we are grateful for the opportunity to live, work, and share ideas in this territory. So what I want to do in this webinar is actually broaden out the conversation to include discussions of climate change. So I know that what we're really talking about today is air quality, but I don't think we can get away from talking about and considering the implications from climate change as well when we're considering air quality. And this is because climate change and air pollution tend to be intimately linked. And so typically when we think of climate change, we tend to think of things like heat waves, extreme heat, hot weather, and that is true. But the thing is, when we consider air quality in there, and we consider air pollution, the thing is heat events tend to co-occur with a poor air quality. We tend to get the wildfire events that we heard about in the presentation from Dr. Allen. And climate change can also lead to other events such as storms, flooding, for example, which can lead to displacement. Cold events are something that we don't typically think of when we think of climate change, but if we think about the changing sort of temperatures and sort of larger variations when it comes to the temperatures, this could lead to an increased slipperiness or iciness, which leads to slips and falls and mobility issues or challenges when it comes to our older adult population. And another thing that we're concerned about with regards to climate change is also drought. And this can lead to changes and challenges when it comes to things like food security or even food safety, such as microbial contamination of some of the food that we're consuming. So I'm not going to spend a whole lot of time on this because, of course, it was gone over. A lot of this was covered by Dr. Allen, but just to emphasize that climate change will also have an impact on older adult health, both directly and indirectly. So through cardiovascular and respiratory routes, through infections, injuries again. So if we're encountering those slippery sidewalks and then we have falls and slips in our older adult population, this is something we're concerned about. Increasingly sleep as well. So if there are disruptions in the sleep because the weather is too warm and people lack air conditioning, this is something that we're also studying. Mental health and neurological disorders. So we heard a lot about that in the last presentation as well. Social isolation is one of those things that we're really worried about with older adults. So for example, in the 2003 European heat wave, a lot of the deaths occurred in older adults and socially isolated older adults. So this is why we're concerned about the connectedness of this population. And again, malnutrition and food security are those other two that I had mentioned in the previous slide. So the other thing that I want to emphasize is that our older adult population, like the whole population, is not homogeneous. And so really what's at the heart in terms of differentiating the risks within older adult populations are these intersections. So for example, if people have existing health conditions, poor support, or they're older and they're lower socioeconomic status, the governance system around them does not necessarily consider their needs, and the public health infrastructure either is not there or they don't have access to it. These can create situations in which we have higher risks in some parts of our older population as compared to others. And so really, when we're talking about this, we can't take away this discussion of these intersections when we're looking at older adult health with respect to air pollution and climate change. So I just quickly want to go over some of the findings from some of the studies that we specifically done in Alberta. And so these are, some of them are focused on cities like Edmonton, and some of them are focused in across the whole province, and some of them are based on literature reviews. And so not surprisingly, we found higher rates of cardiovascular disease and injuries in communities with a higher proportion of older adults. And this has been linked to exposures to ozone and heat. We've noticed higher rates of mental disorders with regards to changes in temperature and air pollution levels as well. Self-reported cardiovascular rates also differed, we found, between older immigrants versus older non-immigrants with respect to higher temperatures. So again, this is that example of those intersections that I was talking about. And one of our reviews of the literature actually found that hospitalization, mortality, and worsening dementia symptoms were associated with heat waves and air pollution. I also just wanted to highlight some of the findings to emerge from some of the focus groups discussions that we've had with some people in the Edmonton community among our older adults. And we noticed some really interesting findings to emerge from this group. And so there is a general concern about climate change and health effects. Older adults didn't necessarily see themselves at risk, but they were concerned about future generations and maybe the neighbors down the street. But the concern was there. But what they also told us is that they had difficulty navigating and finding information about climate change and what to do about it. Because if we think about it, a lot of the information that we have is digitized, and not all seniors and older adults are necessarily connected to these digital sources of information. They also expressed a dismay at the lack of effective leadership in managing climate change, and especially for future generations such as grandchildren, and really the lack of involvement in research and policies and consideration of the needs of older adults in this when thinking about designing climate change policies and adaptation measures for the population. So, of course, this is what we've been hearing a lot about in the news lately. And so the California wildfires, which are still not contained, unfortunately, in Los Angeles. And so even though, despite knowing all the information that we know about with regards to the increased risk among older adults, we're still seeing these increased deaths primarily among older adults and those with mobility issues. And so again, this comes to this idea of intersections that I was talking about. So if there are challenges with mobility or there are chronic illnesses, as an example, the thing is this creates this higher risk that we see for some of our older adult populations. Risk awareness may be something that we also need to work on, because as I said before, what we found from our focus group discussions is that older adults didn't necessarily think of themselves at risk, but maybe it's Joe down the street or Mary on the street, the one who lives alone, who has a walker, who has some other health conditions that make them at higher risk. But what the message needs to be is that everyone, especially when we're talking about wildfires and these kinds of levels of pollution, that everyone is going to be at risk. And again, this idea of communication and being able to reach people where they are through the means that they do access. So just sort of transitioning into what can be done, particularly when we're talking about emergency events, such as the wildfires. Probably a lot of you have heard this before. So just having a plan and developing this plan before the emergency occurs. So I'm working on this with individuals and organizations, and this plan could involve, for example, having a go bag packed and ready to go during particularly high risk seasons or when alerts are put out. And this can include things like medications and relevant documents for our older adults. Also considering developing shelters that accommodate older adults. So those that don't have a lot of stairs or maybe have ramps for people who have walkers, or that can accommodate, for example, oxygen tanks. Making sure that there's appropriate transportation for older adults out of these communities should they need to evacuate. Making sure that there's appropriate communication and checks of these older adults when they're being evacuated and once they're in these shelters, and making sure that they have the support and medical assistance that they need should they need it. And of course, the usual of masking, making sure people are hydrated, and then just keeping an eye out for neighbors and making sure that health monitoring is going on, particularly for our older adult populations during these kinds of events. But beyond that, I also want to stress that we need to think larger as well. We need to think about, of course, involving our older adult populations in these conversations, understanding what their concerns are, what their needs are, developing targeted interventions for our older adult populations that are specifically geared towards helping reduce this risk. And then also considering these intersections. So what does that look like across the population? So making sure that nobody is falling through the cracks and that everyone has access to these interventions. So I just want to end with a few resources should you want to look up more information. The first two are publications from the United States, but the last two, the Climate Atlas and Mobilizing Public Health Action on Climate Change in Canada, are specifically Canada-based resources. So thank you.
Thank you so much for your presentation, Shelby. We will get the links for those resources from you as well and make sure they are shared with everyone. We do have one final presenter. But before we get to that, I wanted to mention that ACA and WCAS are continually growing our membership in all stakeholder categories. So this includes community and public members, industry, municipalities, educational institutions, and more, and throughout each of our airsheds expanding boundaries. So there's a multitude of benefits for different members, including being part of the air monitoring network and building awareness with your communities. If you want to inquire or have a recommendation of who we should invite to be a member, please contact Colton Narabeski, our membership coordinator for both ACA and WCAS. We will drop his email address into the chat for anyone who is interested. And now let's learn more about the impacts of poor air quality on seniors and lived emergency experiences with our next presenter, Kristen Chambers. Kristen is the Chief Administrative Officer of the Evergreens Foundation, a not-for-profit seniors and social housing management body serving 6 municipalities within West Central Alberta. Kristen has been with the foundation for 18 years. Welcome, Kristen.
Thank you very much. So my name is Kristen Chambers. I'm the CAO with the Evergreens Foundation. We're based out of Hinton. We're a housing management body. So we look after seniors and community housing across the West Central region of Alberta. So we're incorporated under the Alberta Housing Act, and we do have nonprofit status. So we have over 600 housing units across our region. And sadly, we have been one of the most affected in recent years by wildfire evacuations. The picture on the slide actually is what's left of one of our seniors' facilities that we lost in the Jasper wildfire this year. That tall piece of concrete is actually our elevator shaft. So that's quite difficult to see. In 2022, we did have a substantial wildfire event that didn't threaten the community of Jasper, but it did, we lost power and had some definite air quality issues. So we did have to evacuate seniors out of that facility 2 years ago. We then had the Edson and Yellowhead County fires in 2023, where we had to evacuate some facilities twice. And that was about a 3-week event. Again, very difficult on the communities that were evacuating, but also difficult in the surrounding communities, which were then impacted by the wildfire smoke and all of the other issues that as a result of that. So these are some of the pictures of a bit of our evacuation from this summer with our Jasper crew. So we certainly see a huge impact on the seniors their mental health, the panic, trauma, PTSD, and really even just confusion as you get into vulnerable sector individuals with mental health concerns. Just the smoke during the day, the different levels of confusion, the changes to, daily routines can be very difficult. Obviously, evacuating groups like this is very difficult because you have mobility concerns. Many are as independent as they are because they have access to regular support systems within their communities, which certainly do break down during these, obviously, within these events. And to Dr. Yamamoto's point, we do see a lot of isolation and lack of connection within the communities, even if they're not in an evacuation situation. If it is, smoke related, heat related concerns with the seniors, they're not wanting to leave the building, they're not going out and, going for their walks, connecting, being out in the outdoors, all of those types of things. So certainly a big impact that we see there. So from a preparedness standpoint, we've done this a few times. So there's been several, we do a lot of resident briefings on potential emergent situations. So, as we hear of that first lightning strike, different things like that, we certainly start the conversations about making sure that everyone is prepared. We have participated in evacuation trials, obviously, with all of our sites. So we have seniors lodges, senior self-contained apartments, as well as family housing. But we also participate and ask for a table with our municipalities. So we really want to work with our municipalities on their plans, understanding what they're doing, who we are, what type of help and communication can we expect so that, as leaders of the organization, we're better prepared to move ahead with this. We have a lot of emergency packs that we have pre-prepared at all of our sites that can be handed off to a bus driver, to whether that's school bus transportation at times. You can see the Sundog bus in the picture, which is actually a tourism operator in Jasper that we used for our last evacuation. So it's giving information that, if they're showing up at a hotel, if they're showing up at another seniors lodge, at whatever place, we have information like, are they on home care, medication, some of their ID tags, family information, all of those type of things. As well, when we talk about an evacuation bag, we don't talk 72-hour bag. A 72-hour bag is really just to get you somewhere in a very fast emergent situation when you don't have time to plan. We want to pack for at least a week, especially with a vulnerable sector population. The reality of bringing anyone back from this population, you really end up being the last group that gets brought back. You need your hospitals up and running, you need your emergency departments, you need your police, you need all of those things. You need your staff to have daycares. So bringing back a vulnerable sector group of people certainly poses different challenges. We found that the 1 week even has its issues, but generally speaking, those prepared for a week, it's been a little bit easier for us to get our bearings when you're dealing with very large groups of seniors and trying to be organized. Another struggle we've had obviously is the staff readiness. So how are you evacuating your facilities and all of your seniors when the staff are getting the same notice that they need to pack up their own homes and their own children, etc.? We have some pretty fascinating stories of our staff riding across town in bikes because of the gridlock traffic during the evacuation times, driving through fields. There's been some pretty wild stuff that's happened. So that is a key thing too, and a really strong conversation that to have with your facility staff is, what does this really look like when it comes down to it, and do your staff and their families have a plan so that they're able to help with the seniors as required while still managing the needs of their own families. Another thing is our building preparedness. So we do have a quite aggressive list of maintenance that we expect at our sites for shutting down our buildings. We got a lot of praise from our insurance companies actually in the last few evacuations about the condition of our buildings when they went back in. So shutting down some of our air handling systems, turning off our utilities, things like that. One important thing is, do you have keys available for first responders within the communities to do any checks, let in insurance providers, different things as time goes on. That was certainly a concern we've had in the last few, was having access into the building for different groups that may need it. So the aftermath of the fire, once you're allowed back in, there's a lot of deep cleaning, sanitation, working with your insurance companies. There's certainly a lot of air quality and surface contaminant testing that you have to go through, and then the building startups. So it's your filters, your consumables, getting your utilities up and running, checking for leaks on those pipes that have been shut down, and all of these different things. There's a lot. The cleaning is a lot more in depth than you can ever imagine. And we were incredibly grateful to have worked with our insurance company who did a phenomenal job. But the level that these contaminants get to on every little item, every sun catcher on grandma's window, every knickknack, it's quite astounding to see. So really that was a real eye opener on really the level that these contaminants get into everything that we have. And then after occupancy, of course, the air is still polluted. So there's still smoke within the community. I know in Jasper, it smelled like a wet campfire for months after everyone was back in. And then there was the ongoing concerns with the air quality due to the ongoing demolition and construction and what that looks like. So we had some continued air quality monitoring, both indoor and outdoor, rented some air scrubbers. We had enhanced cleaning of our entryways with HEPA filtration, and we worked with some different mechanical groups to upgrade any of our air intake filters that we had. So our partnership with the Airshed Society, so they're providing seniors with the knowledge and understanding of air quality. So we partnered with the Airshed in June of 2023 after the Edson wildfire event to install microsensors on all of our lodges. And so actually access to this monitoring is available 24/7 on the live data map. So what was quite interesting actually is as we were one of the first sites in Jasper on our seniors lodge to have internet and power reconnected because we're connected to the Jasper Hospital, which obviously was a key piece of infrastructure. Our micro sensor was the only source of air quality monitoring post Jasper fire for quite some time. So that was really interesting and nice to have that partnership that we were able to be providing that information as live data. So as was brought up prior, the Airshed hosts the AQHI on its website, and we've been working actually ongoing, and I know we have some work coming up with the Airshed to do some potential internal monitoring as well as having all of this data posted on our websites. So again, it's creating, even post-fire that awareness about, what are the impacts? What's a good day to go outside? What does the AQHI mean? And how does this impact, your ability to do different activities within the community, outdoor activities, and how that may link to the individual health concerns that residents have and what they think about, going outside and the risks associated with that. So after we moved in, as I said, we had the exterior air quality monitors, which were provided by the West Central Airshed, working with Yvonne. We did install 4 interior air quality monitors that we had in different areas of the building. And what we've been doing is daily monitoring and logging of all of the exterior and interior air quality. During some of the original demolition within the community, we actually had some air scrubbing units on standby that we were prepared to use if the air quality determined that was the best course of action. Fortunately, we didn't have to use them, but we did take that very seriously, especially with the demographic that we serve and with really understanding what had happened within the facility from that cleanliness and air quality standpoint prior to the cleaning. So then what we can do now obviously is work with our building air intake systems to see what we need to adjust if possible based on those air quality logs. And that's everything. Thank you very much.
Thank you so much, Kristen. That was really great information. I know my family was affected by the wildfire in Edson, and my grandmother was also evacuated twice. I'm sure this information hits home for a lot of people. So we are now going to get to our Q&A. So please pop your questions into the Q&A at the bottom of your screen so we can start answering them. I'll start with one that we've come up with. So I'll ask all of our speakers to please turn your cameras back on. Any of you can answer these questions. Just jump in when you have something to say. So what practical steps can families, caregivers, and municipalities take to help seniors adapt to the increasing frequency of poor air quality events and build long-term resilience?
I think one of the things that we've seen our municipalities doing, and I think groups, is just really thinking in general about, when these events happen, are there spaces within the communities that can be more of that safe air quality space? Understanding that I think the building trends are changing as we're building facilities, as we're looking at renovating facilities, as we're looking at all of those things, having that lens of understanding that these events are becoming more and more prevalent. The impacts are big. And, what can we be doing from the standpoint of either creating these safe air spaces within our municipalities and communities, or really adapting our facilities, whether it's through, renovation, retrofit grants. I know there's some that can be available through different orders of government, and really just looking at, understanding that we need to start really moving the needle a little bit on having this be in the forefront of our planning as we look ahead.
Thank you, Kristen. There is a question for you. What parameters do the indoor and outdoor air quality sensors that you're using measure?
Does Yvonne want to answer that?
I think I can answer that, actually.
You can answer
if you're
that.
using, I believe they're using, well, on the outside, they're using purple air microsensor, and I believe that's what you're using inside as well. So they're measuring primarily fine particulate matter, and the outside one would also measure some meteorological parameters. Okay. Again, please put your questions in the Q&A section if you can. Not seeing any come through yet, but I hope people have questions. I have some other ones. Or Shelby and Ryan, did you have anything you wanted to add on that question? How we can help them build resilience?
Just on actually on the first question, I was going to circle back if I could. Just one other thing I'll mention is one thing I think that can be really useful, particularly during kind of the wildfire season, is paying attention to the air quality forecasts. So not just sort of what's happening outside my window right now, but what is likely to happen, 12, 24, 48 hours from now. Those forecasts, those models that forecast kind of air quality are pretty good, at least sort of in the near future. So paying attention to those and kind of making preparations in terms of, portable air purifiers or modifying behavior, modifying time spent outside, kind of based on what those forecasts are calling for, I think is a good strategy as well.
Thank you, Ryan. I agree. Shelby.
Yeah, and I would just add, to build community resilience is going to take time, but all these strategies that we heard about today are going a long way to building up this resilience, and just planning, making sure that we're taking into consideration the needs of this population, and just making sure that whatever interventions and adaptation tools that we are developing include consideration of the older adult population in these areas.
Oh, thank you, Shelby. Sorry, I realized I muted. There was a follow-up question in the chat about how many sensors are set up in, I don't know your area, but if you look at our live data maps, you'll be able to see all of the monitoring in your area. Yvonne has put the WCAS one in the chat, and we can also add the ACA map as well. So you can go there and take a look and see what is happening for air monitoring in your area. Was the air quality data collected in Jasper made available to the public? I think I can also actually answer that question. So again, the data that's collected by our microsensors in Jasper is on our website. The Alberta government is also running the AQHI, one of their mobile units in Jasper, and that data is also available both on our website and on the GOA's website as well. So yes, the air quality data collected in Jasper is publicly available. Kristen, did you want to add anything?
Yeah, so some of the sensors that we have within the facility, that data was just collected for our internal use, and we worked with different mechanical companies, et cetera, to see, you know, was there any, what were the limits, what were we looking at? And that data from our internal usage is just logged within all of our general maintenance abilities. We actually didn't really see, again, it's a newer facility, so we were able to, you know, be pretty successful with our internal air quality. And then certainly, yeah, the external is all public data as well.
Thank you, Kristen. With regards to air quality and dementia, is there a particular age of exposure associated with highest risk? And is there evidence of a causal relationship? So that's probably for Ryan or Shelby.
Yeah, I can take a stab at that. Those are good questions. The first one is I don't think we know. It's a really important question, but my read of the studies that have been conducted to date is that the answer to that is sort of all over the place. I don't think we know a lot yet about particular kind of windows of exposure being more important than others. Yeah, and then on the issue of causality is always kind of tricky as evidence emerges. It isn't kind of a sudden thing that we go from, you know, we don't think it's causal to, okay, now it's causal. It's kind of an evolution as the evidence accumulates. And it, you know, at this point, it might depend on who you ask on whether that's a causal relationship. But I would say that the evidence is accumulating rapidly. As I said, you know, a number of these studies have been published just within the last 3 or 4 years. So if we're not there yet, I would say we're very nearly there. As I said in my presentation, you know, I think this is moving beyond kind of the epidemiology community, and like the medical community is starting to embrace this as something that needs to be paid attention to with regard to dementia. So that's kind of a long-winded answer, but I would say if we're not there yet on kind of firm causality, I would say we're getting very close.
Yeah, and just to add to that, the thing is the evidence, as Dr. Allen has said, is really piling up with regards to air pollution and air pollution exposure. And I think it's an interesting question to think about from a couple of different perspectives. So we know that things like dementia they take years to develop. And so the thing is, and it's usually quite some time before we start to notice symptoms that we can measure. And so what I think we need are studies that start to look at sort of earlier stages, not just looking at dementia and the occurrence of dementia, because there's, you know, a few studies that have looked at those, as Dr. Allen said, those short-term sort of associations with, you know, exposure to air pollution and then hospitalizations for dementia. But really, if we can somehow go back to maybe cognitive decline or some other measures of cognitive impairment, that can sort of help us build the evidence and the trajectory in terms of not only windows of vulnerability, but also in terms of, you know, how far back do we have to go when we're looking at these kinds of exposures. And then on the other side of things as well, so the thing is, once an individual has or has been diagnosed with, for example, dementia, they're still at increased risk from air pollution exposures, right? And so the thing is, a lot of times people who have dementia have coexisting conditions. And so the thing is, we're worried about hospitalizations and emergency room visits for other things among folks who already have dementia when they're exposed to poor air quality as well.
Thank you very much, Shelby and Ryan. Our next question is, knowing that digital information may not be best for some older adults, do you have any recommendations on what works to share information both in the immediate term and for longer term actions?
So what we found is that it's not going to just be one thing. So some people are very tech savvy and are able to access that information online, but sometimes it has to do with the blasts that go out across like TVs or radios or through phones and things like that. Sometimes it's about people in the neighborhood connecting directly with these individuals as well, and making sure that this information is coming through, or just knocking on their door to make sure that these individuals are aware of what's happening. And the other thing I also just want to emphasize as well is especially in some of our more diverse communities, making sure that this message is going out in probably more than one language. So if individuals immigrated here when they were older and their first language is not English, maybe they, you know, in an emergency situation, they would feel more comfortable if they saw the emergency alert in a different language.
I'm actually also going to ask Kristen to answer that because I know the Airshed has been doing some work with you on communicating with your seniors.
Yeah, so I think that, there's vast pendulum swing with seniors and technology. Like, as Shelby said, there's some very savvy ones that will, let the whole building know what's going on. And there's others that, that aren't going to be looking for that information. So we're going to be working with WCAS on, some potential visual indicators just by, whether that's lighting, et cetera, that kind of shows, outside, is this a good day to go outside? Learning what those colors of the AQHI mean and what that means to them and that awareness. So in a congregate living site, it's certainly a lot easier to, have the staff there to provide that education and that constant acknowledgement of what that means and what that looks like. Certainly we find just kind of education overall. We work with the seniors on various things of technology. So just kind of incorporating this into those conversations of something that they need to be aware of and that it does have an impact on them, I think is kind of the most important. But really just, I think, really honing in on what those colors mean on the AQHI is really kind of a key that we have to say, learn what these are, learn how this could impact you. And I think that's kind of an easy way once you can kind of say, here's the link, here's the button, here's different things. Understanding what that is kind of a good simple way for older adults as well as children or other community members as well to kind of understand, what those colors mean and how that could impact them going forward.
Thank you very much. We do have one more question. Are there specific questions families should ask when looking at potential senior facilities as to air intake and filtration systems?
Yes, and that's for me. It's really difficult because as you look across the province, most of the seniors lodge facilities, when you get into the continuing care, the higher level of care facilities, generally the needs of the residents are higher. Therefore, the buildings were generally built to a different building code. When you look at the more independent seniors lodge facilities across the province, a lot of them were built, some of them even back in the 1960s. And so as an operator, you can really have your hands tied in a large way for even what, you can't just put those high filters into your old systems because they're just not going to work and not going to be able to do the same thing. So I would say, if you know of facilities that are being built within your community, if people are lobbying, if you have groups for doing things, that's certainly the time to start is with the new facilities for sure. And I think as far as being concerned about facilities, I would really focus a lot of attention into what are their plans for both evacuation. Do they have safe spaces for these, for the heat waves, for the wildfire smoke? I think a lot of it needs to be mitigated through the plans of the management or the group. And those are really the important questions to ask because those are the things that can have the greatest impact. And we can't always change those buildings, especially in rural Alberta. Sometimes you have what you have and you're relying on government funding to try to get you to that next big facility. But how do you deal with the facilities that you have and what are those plans? That's really what you need to dive into. And really any housing management body or care facility, we are mandated to have these plans and we're certainly able to share them. So those would be the questions that I would really be focusing on the most.
I think I would also just add to that as well. Maybe consideration of things like air conditioning. So we don't typically think of heat as being like a problem in Alberta, but the thing is it increasingly is becoming a problem. And so facilities with air conditioning, there's going to be some filtration when you have air conditioning units in some of these congregate living facilities. And when we think about, for example, during the pandemic, when older adults were largely confined to their own rooms, the thing is, if there wasn't air conditioning in these rooms and you can open up the window, but if the air quality is poor outside, the thing is like, do you want to do that? There's not a whole lot of options there. And so, yeah, making sure that air filtration and even air conditioning is available to some of these older adults in these facilities.
Thank you very much. Ryan, did you want to add anything? Okay, I think that we are at our time. So thank you everyone for your wonderful questions. As I mentioned earlier, in the coming days, we will have the webinar recording available on our website. It will also be sent via email to everyone who did register today, so please feel free to share the link. You can also email myself or Yvonne, the WCAS engagement coordinator, with any questions or feedback. Our email addresses were added to the chat. If you did enjoy today's webinar, we will be continuing our series throughout the year, so keep an eye on our newsletters and social media for topic announcements and registration information. I want to say thank you so much to Ryan, Shelby, and Kristen for their excellent presentations. I hope you all learned a lot from them. Thank you to our viewers for your questions, and to a few folks in the background here who did help out with things today. That would be Russ for his technical support and Yvonne for her efforts in planning this webinar. So thank you very much for joining us. I hope you found the session informative and are able to apply what was shared today. Have a great day, everyone.